Excited today to introduce a good friend of mine, one of the foremost top Hollywood reporters, Dean McCarthy. He'll be on shortly. We're going to talk all things beauty on the red carpet because you guys know, I mean, come on. How many of you guys follow all the reality TV shows, follow everything High No Veek, follow everything that's going on in the social world? Good morning. Good morning. So I'm really excited. There he is. So we already got a big boost already. So let me introduce really quick. Okay. So, all right. Again, one more time, you guys, I'm super excited this morning. Our lives, especially on the weekend mornings, have been getting thousands of viewers. And today we have one of the foremost Hollywood red carpet reporters, Dean McCarthy. I laugh saying it because he's one of my very good friends for years. When both of us were trying to make it, we knew each other and were really good friends. Hi, Tusher. How are you? We were working hard to become successful. And now, look at, I am the sort of go-to guy for everything cosmetic. And Dean is the go-to guy for everything gossip, beauty, entertainment, celebrities, whatever you want to say in the industry. So I want to welcome Dean, you guys, because people are really excited. Hi, Lori. To hear from you because they're going to see it in a different perspective.
Right.
Tell everybody what you do.
Yeah, good morning, everyone. Jace, first of all, I miss you.
I miss you too.
This is the longest I've ever gone without seeing you. This is
It's
so
crazy. I know.
Yeah, so I'm obviously based in LA. I'm Australian, which is where the accent comes from. And so I interview, celebrities and do all of the red carpets and junkets for different networks around the world. And Jace, we were talking about you on the radio the other day because I want to know, is it actually true? Has Beverly Hills Council seriously allowed plastic surgery right now? Is this a joke or is it a clickbait?
Here's the thing. 3 minutes after Beverly Hills approved elective cosmetic procedures to be able to be performed a few days ago, I posted online, and it had a huge amount of backlash from people.
Yeah.
Now, I was upset because I said this is ridiculous. LA, Beverly Hills in LA County is the fourth highest rate of COVID.
Yeah.
So it makes no sense to me that I would do that. But, other doctors wrote back, well, this is for, people who needed like breast reconstruction where that was considered cosmetic, but they had cancer. Right. I think doctors are going to tweak that rule and start doing liposuction or start doing revision procedures saying that it's medically necessary, even though they're elective. So people have chosen to do it. I have chosen to not do that. I don't feel we can protect our clients because there's not really great testing. If there was immediate rapid testing that was accurate, we could test every person that comes in. But honestly, a couple extra weeks to flatten the curve, stay home, I think is going to make a big difference. It's just shocking to me, though, how many doctors are wanting to do the procedures now, when there's all this risk to people.
Are people hitting you up? Are they sliding your DMs? Look, just a little bit of Botox or something? Because I'm seeing
all the time. All the time. I'm getting it every day. One of my friends here who's an injector is following guidelines and opening on the 18th. That's when people are saying that we can open in middle May. So right now that's where our goal is as well. And we'll see. We'll see where it goes. I just wanted to be one of the first people. So I posted and it has like 1,000 comments on it or something about how they can't believe that people did that Beverly Hills did that,
Yeah.
And look, my friend's saying that everybody's asking for at-home tips or wanting you to come to their house to do treatments right now. Because look what happens when you get into quarantine, You start to grow out the beard, your skin. My skin's good actually because I've been doing my products and my peel and things like that. But yeah, so I wanted, tell people what you specifically do and how it relates to cosmetics, because you're always in front of the stars,
Yeah. So when I'm doing all of the red carpets and the interviews, a lot of the stars are obviously very concerned about their looks and their skincare. And so I think that people will often ask me about what celebrities really look like in person and what do I think they're getting done. So you tell me, who in Hollywood do you think has had really good work and who in Hollywood do you think has had really bad work?
Well, here's the thing, there are a lot of younger clients. I think all the young influencers Vanessa Hudgens, all the Nickelodeon, all the Disney, like all the, you know, very popular Instagram, they're all doing mild cheek filler, a little bit of lips, they're getting Botox. The 20s and 30-year-olds, you know, that are very popular online, they're all doing that work. If you, I mean, the ones where it looks really bad are the people that had surgery many years ago that did big lifts and big lasers, because we weren't really good at manipulating and hiding those scars and doing little tweaks. But the majority of people, younger or older, are doing treatments now. Even men are starting to do a lot of lips. They're doing jawline contouring. You look at people, like everyone comes in saying they want to look like Colton Haynes when they ask about jawline. And, you know, I wouldn't be surprised if somebody like him is doing little tweaks. You wouldn't know, because he already has that structure. They're just enhancing it. So many people come in and they ask for, like, you know, like J-Lo, for example. She's doing work. She looks great though, you know, but she works out, she takes care of herself. So it's a mix of things, but everybody's doing something for the texture of their skin, good skincare, peels and lasers, microneedling. Everybody's doing things to sort of slow down the sagging process. That's where people notice, you know, sagging here, dark circles, sagging in the jowls. They're doing skin tightening procedures. They're doing fillers. It's all about, like, you know, harmonizing the face using the various techniques we have. When it looks bad, you know, because their lips walk into the room before they do, you know, or the cheeks hit the door before they walk out. That's what I always say. And, you know, I'm sure you see a lot of that where there's puffiness under the eye, or their lips are super big. You know, sometimes it's a generational thing, sometimes it's a cultural thing, sometimes it's just bad work.
What can people be doing, like, while we're all sitting at home, what can people be doing at home to keep their skin healthy?
Well, you know, every day we've been doing little lives talking about products that we love and different protocols. Yesterday I did a protocol of what you can do before you go out on a run to protect your skin. Everybody should be doing, now you have the time to do light peels. You have the time to do micro rolling, derma rolling at home. We have whole protocols for that on my website, emeragecosmetics.com. There's a code, Stay Safe, right now to get 20% off. A lot of people are taking advantage because they want to get products all the time, but it's a little more expensive. So now they can get the peel and do other things on emeragecosmetics.com for less expensive. But you need to be doing a vitamin C every morning. You need to be doing some sort of lightening, something that reduces sun damage and keeps the skin even. That could be a glycolic acid or a kojic acid. And our age group, in that mid-20s, 30s to 40s and up, need to be doing growth factors and stem cell products. Now, these are your hero products. They're more expensive because they have peptides. Hi, Ryan. Because they have peptides and they have growth factors in them, and they're from literally from stem cells of either plants or human bone marrow, sometimes even fat cells. But they help repair the skin and reverse damage there. And that's everything in the morning. And at nighttime, everyone needs to be on a retinol and some sort of lightening cream and a really good moisturizer. We've been recommending a lot lately this really great line from Japan called Faith. I want to get some of that in you because your lighter skin tone have a little red. So people who naturally have a little red hue to their skin, they're lighter with blue eyes. This decreases sensitivity. It helps improve the quality of the skin, the plumpness without any sensitivity or without any irritation. Was designed actually for patients on cancer therapy. So there's a lot you can do. Masks, at-home masks. We actually did an Instagram yesterday of our 4 favorite at-home masks. One was a clay mask from Faith. One was an enzyme mask that had papaya in it from Jan Marini. One was a glycolic or a what we call a mixed acid mask from alpha mask from EMK, which makes bioplacental stem cells. So it's a stem cell mask. And then the other is a lightening mask. So we have, I mean, people can be doing everything. It's more about what are their concerns, you know?
So wait, what are the craziest things you've had people ask you to do? Because I watched Botched. Right?
Oh yeah, you remember Dr. Nassif was my partner basically. You know, the thing about Botched is that's overdone work and they're always coming and wanting crazy things. I mean, I've been doing really interesting things lately. We've been doing a lot of down under treatments, genital enlargement, anal and vaginal bleaching. We do a lot of that. We've been doing, even now, my clients have been saying, oh, it's perfect time. I could do my vagina peel at home. And so we've been sending them kits to do their vagina peel. You know, it's like unbelievable. We do male filler injections to make people a little bit larger. And the funny thing is, the guys that come in for this are already big. It's always they want more. It's never the smaller guys. It's always the bigger ones. I've done a couple nipple filler to the nipples to make the nipples a little more protruding for women that want to show off their breasts. You know, we do interesting things like my Asian patients like eyelid filler. They feel a little hollow in here, so we're injecting filler into here to kind of fill it out. I don't know. There's so many different things that people come in for every day. I feel like you just have to follow me for a week. And then you'll see. I mean, it's so crazy, you know, what people are asking. Everyone's here laughing and they're like, you can do that? I'm like, I know. It's unbelievable what we can do. You know, a big trend right now is to do hair treatments, is prevent hair loss. So we're doing a lot of stem cell therapy and PRP where we draw your blood and do it to your hair. You know, you get that on your face. It's your favorite thing.
Yeah, what do I get? I don't even
know. This is what I love about Dean and my clients. They just trust me. So for all these years, Dean hasn't aged, and then he doesn't even know what he's done. That's the thing, you guys. He doesn't even remember. And I remember Jennifer Aniston even asked you one time, remember? On an interview, she says, how is your skin so good? And you're like, I just go to Dr. Emer and he does this blood thing. And she's like, oh my God. So, you know, so he does microneedling with PRP and uses a laser called Clear and Brilliant. And this is great because the idea of this is you're young, you don't want to have a lot of downtime, but you need to look good. You're in front of the camera, you have to wear makeup, there's other things. We want to keep it looking good all the time. So Clear and Brilliant's a really light laser for those that don't know it. It just does the surface, it shrinks the pores, it helps pigmentation and fine line prevention. It's something you should do every couple months. We combine it with microneedling where we use little needles to puncture the skin. Remember, the roller at home doesn't bleed, but the one in the office goes deeper so you bleed, and we draw your blood and then apply the serum to your skin, and that's called microneedling with PRP. Some people call that a vampire facial, you know, or a vampire lift is when they inject it. I don't think that really does anything. I think it's just marketing. But skin-wise, it does really good for texture, pores. It helps you look good. And, you know, you look young. I mean, I think the average person should do a larger peel or a larger laser a couple times a year where they look really, really bad and peely for a week. But if you don't have the time, doing those lighter things would be really good. I mean, a lot of men are doing Botox even on their skin. We call it aqua gold or ampule infusion, where we actually needle Botox in. It shrinks pores and redness without downtime. And so things like that are very minimal downtime is what people are doing. Now, obviously, you know, people are getting fillers for contouring and sculpting. I'm sure you've seen some terrible fillers. When you see a bad filler, how do you know?
I cringe because it just doesn't look real or natural, and they lose like expression and they just look a bit. But I feel like a lot of the stars are actually pulling back on a lot of Botox because they have no expression and they look frozen. If you got makeup and a camera, all of a sudden they look even more smooth. So I think they're pulling back on a lot of that. One of the things that you've started doing since we became friends like 5 years ago, which still blows my mind, and friends, you've got to go and check out his page because it will absolutely blow your mind, is the ab and body etching.
I know.
Describe what that is and how that actually works.
Well, you know, it's funny. When I moved here and I didn't know anybody except for you, I go to Equinox, West Hollywood. And for those that are not around here, Equinox West Hollywood is like every famous actor, model, and celebrity. And so I go in there, I'm out of shape, you guys. Okay. This is like true. This is the TV, you know, this is the gym of the TV stars. So you go there, everyone's ripped, and I didn't know anybody, right? So I hand out my card, I'm meeting people, whatever. Now I go there, I have to go there super late at night and hide because half the clientele have had my ab sculpting or my facial sculpting. They all want to talk to me. We go in and we remove fat between the abs and around the abs to decrease the size, but also sculpt everything out. 5-6 years ago when I moved here, most people were not doing this. They were just doing traditional lipo, or just remove a little fat. Sometimes it can look
Yep.
irregular. You've seen people that have had bad work, you know.
Yep.
Now we do this contouring, the shaping, the V-taper. I take fat and inject it to the chest and shoulders and the arms to make people really muscular, and it really helps them when they get back in the gym. A lot of doctors are starting to do it now, but they're doing it, I hate to say this, but half-ass, where they just kind of go around the abs. They'll shape the fat. So you were a fat person going in, and now you look like a Ninja Turtle walking out. Because you have it. It looks terrible. And you guys, if you're going to do this procedure, you really need to go to somebody who understands anatomy and is thinking about you for the long term, because once you do, hi, Sassy. Sassy Spikes says hi. And by the way, all these, you have so many people here just like loving on you right now. And you have to go to somebody that knows, because a lot of doctors are trying to do this now because they think that it's a good marketing ploy to get people in and spend more money with them. But bottom line is it needs expertise and skill to have a natural result long term. And high def lipo, and right now 60% of my clients revision, fixing all the bad work. We're doing a lot of male chest revision. We're doing a lot of female stomach revisions, a lot of buttock revisions. You know, in the past, all the celebrities were getting the Nicki Minaj, the Kim K, huge asses, you know. And now everybody wants that reverse. They don't want the butt, the saggy butt is what I call it. You inject the fat, it gets really big. It looks nice and plump. And then after a couple of months to a year, it sags like a wet diaper, you know. Thanks, Craig. You know, they're asking me about at-home peels. Let me tell you, because Dean, you were asking what can you do at home. You know, there's 2 peels that you can do safely at home. One's called Cosmetic, the other's called Enlighten. Enlighten I created because Cosmetic's a little expensive. It does an amazing job, but it's a more expensive peel. It's originated in Spain. It has a really strong retinol in it. It's compounded medication. It's a doctor prescribed medicine. Enlighten is a similar but more retinol based. So you get really red and peely for about 10 to 14 days, but it reverses a ton of sun damage. So if you're okay looking like you have, you know, a sunburn and light peeling for a week to 2, you're going to get a significant improvement in both either Cosmetic or Enlighten. Enlighten is going to be a little less. It's less expensive, less of a result. But on emeragecosmetics.com, we have both, number 1. And number 2 is I have a post-care that's recommended that enhances the peel so that you also get an anti-aging benefit and you get long-term skincare. So a lot of people can be doing that. You know, Missy, we've been talking about it every day. It's also on our emeragecosmetics.com. We'll put some more recommendations, but follow our stories because it's all on there. And every day we're doing it. They're laughing about the wet diaper thing. What else? I mean, I want to know, because when you're walking down, you're seeing what is beautiful to you. What stands out to you on the red carpet when people actually look good? Because you look at like people, like I said, like, you know, J-Lo and Sofia Vergara and a lot of like these bigger name people, they look very natural and really pretty. What stands out to you that looks good and bad?
Skin. It's all about
skin. So
for example, Jennifer Aniston, she still has full movement, but it's her skin. Like, I don't know what she's doing. J-Lo's skin. So I think that even, like, especially for men, it's great to have an expression and still have expression like smile lines and frown lines, but just great skin, I think, is the trick that makes them look better.
Yeah, and I say, you know, the forehead is the area where you can really notice Botox the most. So if you're worried about getting, you know, this to be frozen, I would do less up here and more around the eyes and here and on the neck area, because those areas you don't really notice it as much. But stop over Botoxing your forehead, guys. Nicole Kidman, for example, she looked very flat and like loss of volume on her forehead for a while, and now all of a sudden she looks so good. And the reason is because they stopped doing the Botox there. You can tell it was so much less. They're also asking about light therapy. So one of the things I always tell, so let me go back to the skin really quickly. So I always tell people this: your skin is like a car. It gets dirty as it goes through the environment. So you need to do things like your car wash to make the skin look good. That's those peels. That's the right skincare. It's lasers. So most of the celebrities are doing lasers, peels, and skincare, and less filler and Botox to look really good. The trick right now is skin tightening. So they're doing microneedling with energy. You haven't done this yet, and I would love to get you in to do it. The best one on the market is called Morpheus, but there's other ones called Fractura, Infini, Intensive. They basically puncture needles. The needles go in and they heat at the same time. So they shrink wrap the skin. They make this tighter. They make the jowls tighter. They lift it. So a lot of celebrities are doing that over doing the fillers. Although you can do both well, it's good to start skin tightening. And you have to think of that differently. That's long-term prevention of sagging, keeping your jawline contour, lifting the cheek, lifting the eyebrow. They're even putting in little threads to lift the eyebrow.
What is that? What are you doing when you?
So those are little sutures that we place in there to grab here and just lift it up, so that people get more of an eyebrow or eyelid. Like, it stays for about a year, depends on what type you use. But if it goes wrong, you're in big trouble. You could have lumps and bumps. You could have, I've seen a girl like this. Literally where I was like this, pulled, and we had to cut the thread. So it's crazy, I know. So they're saying, can you do Morpheus 8 when you're 28? Yes, you can start any skin tightening and lasers. Mesotherapy, you guys, it only does the surface, so fine texture. It's not going to improve long-term tightening. I'm just answering some questions. And they're asking, can you do filler in the forehead? Yes, you can, but it's a dangerous area. So when you get fillers, you know when you're injecting, there's blood vessels that are there. And if you hit those blood vessels, and it could be frank bad luck, it also could be just the fact that the person's inexperienced. It could cause blindness. It could cause loss of skin. It can cause damage to the nose and the forehead. So you really have to go to somebody that knows what they're doing. You know, don't you think? And then, I was going to say, when you said that about the Jennifer Aniston glow, that's because they're doing their regular facials. They're getting the microneedling. They're doing lasers, and they're using proper skincare. And that's what you need to do. And those, and a lot of my clients are also doing red light therapy. Someone's asking about that, so that's what I want to say. So red light is infrared and different wavelengths of light that go onto the skin to heat the skin, just like photosynthesis is for plants. You know, light helps plants grow. So red light, blue light, and green light help our skin do different things. Decrease inflammation, build more collagen. The type of light we like is light stim because it's really inexpensive. It's only a couple $100s for a handheld device. Blue light for the acne and the red combo for anti-aging. You can get it at emeragecosmetics.com. COVID discount, stay safe, because they're asking about it. It's a set price throughout everywhere on the internet, but you can at least get a discount now, and that you should be doing a couple times a week. Now I have clients that do it every day. They're feeding their baby with the breast, and they're in one hand, and they're using the light in the other. Or I have other clients that are, you know, watching TV at night, and they're just using it. I wouldn't recommend necessarily sitting in a bath because it has a cord, so I'd be careful if it falls in. But in general, you know, that's something you can add to your regimen. And yes, you can do derma rolling at home, you guys. I did a whole video in the shower of me doing rolling on my skin. You can also do free skincare consults with my coordinators right now for skincare, and they'll go over the whole derma rolling protocol.
Someone just asked a really good question. Do those collagen pills and those collagen powders and that, do they work? Is that?
No, really? No, listen, topical collagen works. Oral collagen, this much gets absorbed, very minimal. So all those influencers telling you to buy those super food products with collagen, they're going to do very little for you. The collagen gets degraded in the stomach. But there is a product, there's only very few full collagen products that work on the skin surface. And the one that we like the most is called the Essence Serum by Lame Labo or Faith. It is unbelievable. It comes with a little bottle of aqueous vitamin C. You pour it into the powder of collagen, and then you keep it in the fridge for the month. And you put a little bit of the collagen on, and someone's saying here, okay, I'm going to do Morpheus 8 and collagen. If you do that, if you use the Faith line skincare and just do Morpheus treatments and a couple peels, your skin will look phenomenal. That's what most of my Hollywood celebs are doing, and I don't tell everybody because that's the secret. But yeah, we're doing, you guys, we're doing virtual consults, emeragecosmetics.com. You can do those anytime. will reopen soon. We don't know. I just want to hear more, Dean. What else do people ask about? What do the celebs do? Because everyone's asking me about you.
What do they all do? It's lasers, it's peels. And like I've said, I've really noticed in the 8 years that I've been here, such a change in Botox. Like, I used to get here and everyone was so frozen, and now that is just not the case. Especially
I know, and I also think filler too. I think people are using a little more of the things that stimulate collagen and less just plump. Unless someone wants a nice contour, like, you know, you look at like some of the younger models, and you could see like very chiseled jawlines, like a jawline and cheek, like Gigi Hadid, or you know, that's their look. What
is that real? Like, is Gigi and Bella?
Yeah, I mean, she look, she's probably had some surgery. There's some hollowing and things that she's had here, but she's got to be doing enhancements.
Okay.
Her brows are really elevated. Her cheeks are really contoured. You know, in general, that is what they're doing, but they're doing less of that, and they're doing more of the skin tightening and the peels at home. Like I said, the 2 peels at home, because they keep asking me, are Cosmetic and Enlighten, both on emeragecosmetics.com. In the slider on the top, you can get information. I have tons also of videos on YouTube and Instagram on how to use them. The serum, the collagen serum, is Faith Lame Labo Essence Serum. It's unbelievable. Vitamin C and collagen, made for sensitive skin. Even if you're allergic to vitamin C, it's phenomenal. They're also asking about IV drips. Do you think that celebrities get IV drips?
Yeah. For sure.
I'm sure. I actually think a lot of them have private people that come to their houses, especially after concerts. You know, I look at Travis Scott's concerts. My God, that guy's like running around screaming. Post Malone. I guarantee you, IVs. They're doing IVs. We do a whole amount of IVs in our office. We actually have a website, ivworld.com, iv/world.com, that talks about all the IVs that most of our clients do, our athletes do, and also just rejuvenation. The average person is dehydrated. They're drinking a lot of soda, they're running around, they're not hydrating well, they're working out, they're taking amphetamines, who knows what they're doing, they're getting dehydrated, your cells don't work as well, and you know your skin doesn't look as good when it's not plump. So you can do an IV every week and help hydrate, and add glutathione to it and vitamin C, because it'll help brighten the skin a lot. There's a hot trend right now in Hollywood to do NAD therapy, which is a very strong antioxidant that helps your mitochondrial cells that are in your actual cells function. It's like the powerhouse of your cells. And this NAD goes into those cells and makes them replicate and turn over faster. It's sometimes an 8-hour infusion. You'll stay in the office, or you'll carry it around in a little pack, but you do a series of these once a year, or you could do it more if you want. And it's been shown to prolong life because it decreases inflammation around the heart and the joints. And we do that in our office too. There's a huge trend. I have patients that'll come in after surgery, and they'll start their NAD infusions to help them heal much faster. NAD supplements don't do that much. I know you guys, they're saying Dr. Sinclair talks about NAD supplements. Look, any supplement, a small amount's going to get in there. But in general, they don't really work. But that is a big trend that my clients are doing. They're also doing IV stem cell therapy. It's crazy. But when you have the money, and your job is to look good and feel good and be, you know, you got to take care of it. You got to.
What do you think is, like, when we first met, obviously, like, I hadn't even heard of like ab etching and like, you know, pulling your own plasma and putting it back in your skin. What do you think is the next craziest thing that you've heard of that's coming that we haven't even seen?
There's already one that's kind of been coming, and I'm really kind of pissed off about it, no offense. Because people are taking the plasma and they're actually putting it in a cream, and they're sending you home with it.
Your own
and you're taking your own blood home in a cream. So it's a blood cream. And they say, oh, this is safe, it's healthy. I mean, honestly, the plasma, it doesn't survive more than 4 hours out of the body in general. And, you know, they're asking right now, people are putting sheep's placenta on their face. We do it in our office, actually.
Really?
When we get back, I would love for you to do a sheep placenta mask. People love it. It's crazy. It's this trend of where people get these ingredients. I don't even know where people come up with this. It's like I was walking by a coffee shop the other day and I saw some mushrooms growing, and I turned to my friend and I'm like, oh my God, look, this little garden has shrooms. He goes, cut them and put them in a cream. People will use it. I was like, that's what people do. You shouldn't do that. You have to go with the tried and true and not always with the trends. But another big trend right now is the plasma pen. That said, I don't know if you've seen it, where we take a little pen, and I was on the doctor's show for it, and we do little zaps, and it forms little scabs all across the skin. And then a couple weeks later, it contracts the tissue. I think with safety and combined with lasers, it can give such amazing results. Where skincare is going, I think it's going to be dumbed down a little bit, because these exotic extracts and botanicals and shrooms and all this, I don't think people really are going to care about that as much as the tried and true retinols and vitamin C's and sun protection and peels. Obviously, blood plasma cream is a craze. I don't think it can help you, and I think there's risk of infections and things like that. But Paula Abdul is promoting it. She's huge in promoting it right now. She's promoting that and internal skin tightening. She looks good for her age, so who knows? Maybe but she's been a dancer. She's taking care of herself. You know what I mean? For many years. And I mean, I don't know what the next craze is. I will say what's making a little bit of a comeback is foot filler, and a lot of. I used to do this for years, where we put filler in the bottom of the feet for women that wear high heels because their feet hurt them a lot, or people that run marathons and their balls of their feet, they have tendonitis there. And an earlobe filler, so women can wear bigger hoops and things like that.
I can see that. I'm okay with that.
With men, it's more, I think men are getting a little bit more risky when it comes to the lips. I have two very bro mask celebrities. They're in their 60s. They're like known for being like the most strongest men. And I'm looking at them on the runway and everything now with their lip filler, and I'm laughing because I remember when they told me I would never do that, and then I do it and they look so good and nobody knows. So the newer fillers that are out are more fluid, they're softer, they don't look overdone, they can just look hydrated. Plus, I have on right now Lucy & Co. It's a lip plumper combined with a Restorcy Lip Magic, which is an enzyme that basically eats away the flaky skin on your lips, because I'm always dry and dehydrated. So we need to get you that, because you can put that on before your interviews. Your lips will look nice and pink. They'll look very soft. You can do that and almost look like you have lip filler even though you don't have it. Let me see. They're asking about
biofillers. What's a biofiller?
So biofillers we don't actually carry the main biofillers that people are talking about, but what that means is fillers when injected that stimulate long-term collagen. In the United States, there's only two. There's one called Bellafill, which is made of acrylic beads in a collagen carrier. Very safe if you know what you're doing, but if you don't know what you're doing, you can get lumps or bumps, infections, and granulomas. So you don't want to do that, but I do it very frequently on guys' jawlines, cheeks, and temples, ears. It's very good because it lasts 5 to 10 years. Another one is called Sculptra, and this is the secret I think the celebs are doing, where they're injecting Sculptra and then it disappears. It's a powder that's mixed in a solution. It goes into the skin. And then over the course of a year or 2 years, it lifts the skin and builds collagen there. And if it's done well, it looks really good. You look more youthful. If it's done really bad, you look puffy and round. So like for example, Brad Pitt, who I thought was very chiseled, he was getting really round over the past couple years. And I was thinking it was because people were overdoing Sculptra or fillers on him. Now I think he looks more sculpted. I think either they backed off or he's done something.
I the Golden Globes this year, and he looked great.
He really did.
He still had plenty of movement. He just looked fresh. He looked actually really, really, really good. Just looked young. Like so that's Button. He's basically that in real life, basically.
I agree. I will say, and don't take offense to this if he sees this, Mark Wahlberg, he'll kill me. But I think he needs to come to see me.
Really?
Him and Justin Bieber. If I can get them both to come to see me. Bieber has terrible acne and could make his skin look so good. And Mark Wahlberg is very rough. You know, his skin is like Robert De Niro, very rough. I just want to soften it a little. He's got that beautiful look, you know. Like if it was just softer, he would look so much healthier. And he's got deep lines and stuff. I just think it would look good if he just did some subtle things, you know. They're also asking, what can you do if you're on a budget? Here's the thing, you guys. Couple things. One, my skincare consults are free. I'm doing this on purpose so you can get doctor information for much less expensive. On emeragecosmetics.com, go to virtual consult. They can help you.
Okay.
There are many products that are out there. You don't need to spend $300 on a La Mer moisturizer, okay? A basic retinol, it should be a staple, and a vitamin C. You can get Is Clinical Pro Heal. You can get SkinCeuticals, $80 to $100, and it'll last you 2 months, and it's a great vitamin C. Retinol, RevSkin Retinol, Sente Retinol, BioComplete Serum from Sente, or RevSkin Retinol, $60 to $90, 2 months worth. It's going to prevent wrinkles and pores. That you need to have that as your staple.
Okay.
Restore C Cleanser, which brightens the skin and cleans the skin, is a little bit more expensive than an over-counter cleanser, but gives you results. You know, these are the basic things. A glycolic cream that I love is from Jan Marini called BioClear.
Yep.
That cream has 3 acids in it, including azelaic acid, which is for brown spots. It works great, and I think it's like $80, and it works really, really well.
I get their body scrub from your
yeah, you have the glycolic body scrub, which all my clients that work out love that.
Yeah.
And you know what I do? I use that body scrub in the shower, and then when I get out of the shower, I use the actual cream on my arms, and I use a spray from RevSkin with a similar ingredients to spritz as a toner on my body, and it keeps acne away, keeps redness away. He's talking about the Jan Marini BioClear scrub that's used in the shower for those that get pigmentation or folliculitis, where they get hair follicles, acne. You know, ZO is good. I think it's a little overhyped. I like a little bit more medical grade. And yes, this will be up for 24 hours, and then afterwards, it's always on our YouTube, guys. Follow our YouTube. Now, if you want to invest a little more in getting anti-aging, then you go into the growth factor and stem cell products. Our favorite bone marrow product is human bone marrow stem cells. Is Anti-Age MD. It's crazy. It's amazing. It has in it hyaluronic acid, vitamin C, growth factors and peptides, bucuchiol, which is anti-inflammatory and decreases pigment. And then our less expensive, more of our vegan type of result is, or type of product is EMK, is BioPlacenta from plant. And that is stem cells from plants that helps kind of rejuvenate the skin. There's another product line called Rejuvafil, which is chlorophyll based in green tea. And so it's your superfoods for your skin. So there's lots of options, you guys. And like I said, the Faith Lame Labo Essence Serum is an amazing collagen. So, you know, you have to just start somewhere.
Yeah.
And the basic is like what we said, a good cleanser, a good vitamin C, a good retinol, and a good glycolic cream. Start there. Do derma rolling at home. You know these, because my patients will come in and say, I want to look like Jennifer Aniston. You know she's doing thousands of dollars of treatments a month. You might not be able to afford that, but in office, you could do basic microneedling for a few $100s. You could do light peels like we're describing in the office, or even at home, a little more expensive 2-week peel, but you could do that a couple times a year and get a really, really good result, you know? Now, what else do you want to ask?
I've gotten a lot of value out of this. How can someone have a conversation like this with you? Do they book it like a telemedicine on your website?
Yeah, I mean, look, if someone wants to pay for me, the money they pay goes towards a credit in the office. So it's good, it's a credit. If they don't want to pay to have my consult, my skincare consultants, esthetician, nurse, and PA are very good. And they can do that consult, emeragecosmetics.com. EMERAGE cosmetics.com, right at the top in purple, virtual consultation. You can book it or email appointments@jasonemermd.com. Now, if you purchase a peel, you have to do a consult. So we'll automatically set up the virtual consult regardless, because we want to make sure you're safe.
Do they do the peel at home and you or one of your team talk them through how to do it?
Yep, we do a virtual application. We even send a selfie light. And we have them send us pictures every day with the selfie light. I love doing that. It's so cute. It's like Emerage Cosmetics selfie light. We'll be back in New York, you guys, in 2 months. And they're loving everything. So Dean, what else? Let's finish because it's getting long. What else do we want to say? We're going to come back with more.
Well, I want to do one of the peels at home. I want you to talk me through.
Oh yeah, so I'm going to get you the Enlightening Peel. It's perfect for your skin. You're going to love it. It'll be easy. You can go all the way around, all through here. Do a little on the neck. You'll do great with it. So yeah, that's it. So guys, Dean is amazing. He's my good friend. I'm really glad that he took the time to do this during COVID. Anything you want to know from Dean, DM us, because the next time we do this, I want to talk about talk soup, basically, about certain celebs. I want to see, maybe we post some pictures of a few and we say, what do you think they had done?
Good Dean, let's
do something fun, you know?
I love it.
So, all right, well, thank you guys for following. Thank you, Dean. This was great. And we'll stay tuned for more. Have a great weekend, you guys. This was Dean McCarthy. Follow him. Follow his Instagram. Do you want to tell him your Instagram handle?
It's just Dean McCarthy on Instagram, Facebook, and
Perfect. And then they'll be able to follow you, and you guys will love all the stuff he does. He knows everybody in the industry.
So good to speak to you, Jay.
Bye, guys.
The second this is over, I'm coming into the actual office, which is...
Can't wait. Yeah, I know. We need you. I want to get you a facial, and I'm going to send you the peel so you can do it next week. We'll do it on live.
Love it.
Okay.
Bye, Jay.
Bye.
Bye, guys.